Hi students, this is the video head and neck revision part 2, and here last video up to pharynx we have seen, and this video we start with the larynx. The muscles of the larynx. First you have to write about the cartilages. You have the paired and unpaired cartilages if it is asked as an essay. The paired cartilages are both sides should be there. So arytenoid cartilage, carniculate cartilage and cuneiform cartilage. And here unpaired cartilages in the middle are your thyroid cartilage, above that your hyoid, and then your cricoid cartilage. These three are the unpaired cartilages, midline cartilages, epiglottis. Okay, epiglottis, thyroid cartilage and cricoid cartilage, three cartilages. So three unpaired and three paired. And then next we are going to see the inlet of the larynx. So if you see the inlet muscle membrane are there, you have at least two membranes you have to write. One is thyroid membrane which connects the thyroid and the hyoid, and another one is the quadrangular membrane which is present inside. So you should write in detail, but this is a revision video, only key points I could give. And here is the inlet of the larynx. Inlet means the first part. Okay, look at this. This is the inlet of the larynx where it enters inside. So here the boundaries are epiglottis anteriorly, both the sides are epiglottic fold. This is called quadrangular membrane, and this border is called as epiglottic fold. And here you have the arytenoid and interarytenoid structure is there. And then next one is you have this is inlet. The next one is the cavity. This is called the cavity of the larynx. So when the cavity of the larynx is asked, you have to write about this is your vocal cord. Look at this, the fourth one, that is your vocal cord. The second one is your vestibular fold. So vestibular fold is here, vocal fold is here. So the vestibular fold is the quadrangular membrane is here, right? So the inferior border of the quadrangular membrane is your vestibular fold, and the vocal fold is cricoid. This is thyroid. So cricovocal or cricothyroid membrane is here. So this is the upper thickened part of the cricovocal membrane. That is your vocal cord. This is the definition. Upper thickened part of cricovocal membrane, and this is the lower border of the quadrangular membrane, right? See these two, and in between these two you have the glottic area. Above the vestibular fold, that is the supraglottic area. Below the vocal fold, that is called as infraglottic part. So three glottic part you have to mention, and the supraglottic part now supplies internal laryngeal nerve, and the glottic part or this area is called sinus of larynx. This area is supplied by the internal laryngeal nerve. So above the vocal cord, the entire thing is supplied by the internal laryngeal nerve. Below the vocal cord, it is supplied by the recurrent laryngeal nerve, and beneath that, beneath the vestibular fold, you have to write the saccule. Saccule contains mucous glands. This mucous glands, they are for the lubrication of the vocal cord. Okay, so you have to mention all these points, and the most important point about this glottic area, it is devoid of lymphatics. No lymphatics in this area. Very important question. That's why if there is any tumor in the glottic area, there will not be any lymph node enlargement. And infraglottic part, it will the lymphatic drainage is pretracheal lymph nodes, because it continues down into the trachea, right? So this is pretracheal. This is about the cavity. So one short note over laryngeal cavity, and the second one is the muscles of larynx. So whenever you talk about the muscles of the larynx, you have to talk about posterior cricoarytenoid and lateral cricoarytenoid, cricothyroid and thyroarytenoid. All these muscles you have to mention. There you have to put the subheading as which one closes the inlet, which one opens the inlet. So closure is for that we need to draw a picture. So for that we need to draw the diagram. So let me draw the diagram. This is your epiglottis, this is your arytenoid cartilage. Okay, this is your vocal cord, and both the sides. Okay, so here is your cricoid cartilage, this is your cricoid, and this is your arytenoid, this one. And from the posterior part of the cricoid, it goes to the arytenoid cartilage. This is a muscular process of the arytenoid. So what will happen? So if it pulls like this will go for abduction. The vocal cord will move out, so it is abduction. So posterior cricoarytenoid is abduction. Lateral cricoarytenoid goes from here to here. So what will happen? It will come inside. The vocal cord will move inside, so it is causing adduction. So posterior cricoarytenoid is abduction, and the lateral cricoarytenoid is adduction. And the next one is you have one more muscle called from this side arytenoid to the opposite side. It is called as, can you see the muscle is going in oblique direction from this side to opposite side, from this side to opposite side. So this goes along the epiglottis. So this is called oblique arytenoid, and it ascends up along the epiglottis, it is called as aryepiglotticus muscle. So this side also it goes ascends up and it is called as aryepiglotticus. So you have the oblique arytenoid, it goes ascends up and it is called as aryepiglotticus. Both of them, if they contract, they will close the laryngeal inlet. So it is called as closure of the laryngeal inlet. And in the front you will be having the cartilage called thyroid cartilage. From the thyroid cartilage to epiglottis, if a muscle comes, what will happen? The muscle is coming from the front. So if it pulls, the larynx, that cavity is opened. Okay, if it pulls from this side, this is thyroid cartilage and this is the epiglottis. So if somebody pulls from outside, it will be opening. Somebody pulls from inside, it is closing. So who is the closure? Oblique arytenoid and aryepiglotticus. And who is the opener? Thyroid to epiglotticus, thyroepiglotticus. Understood? So this only I have given. And then next is your posterior cricoarytenoid, lateral cricoarytenoid I have given. Next one is the tensor of the vocal cord and the relaxer of the vocal cord. This cricothyroid muscle is only extrinsic muscle of the larynx, only muscle which is seen outside, and it is also supplied by external laryngeal nerve. This alone. So this is the tensor of the vocal cord. So thyroarytenoid is the relaxer of the vocal cord. All these muscles you keep it in mind. If muscles of larynx is asked, you just name the muscles and give its action and then give its nerve supply. Nerve supply, all the muscles are supplied by the recurrent laryngeal nerve except your cricothyroid, which is supplied by the external laryngeal nerve. You have to mention. And then next is your I have given you the supraglottic, glottic, infraglottic part nerve supply. And next important is paralysis. So both the sides, if there is bilateral partial paralysis of the adductor muscles, it means recurrent laryngeal nerve palsy leads to complete adduction of the vocal cord. It is a very dangerous condition. Understood? For the explanation, you have to go and see the complete video of the larynx, right? Okay. So at least the student should write bilateral partial paralysis of recurrent laryngeal nerve leads to complete obstruction, leads to stridor. Number 1. And then unilateral paralysis of recurrent laryngeal nerve leads to the opposite side cord will act and then it will compensate. Like that you have to write. Next is cavity. You have seen vocal cord. Very important short note. Vocal cord, you have to write about the layers. The first layer is the mucosa and the second layer is the lamina propria. And third layer is the lamina propria contains 3 layers. The superficial layer contains collagen elastic fibers and the intermediate layer is elastic alone, and the deep layer you will be elastic and deep layer will be having the collagen fiber, right? So first layer, just have a look, both fibers, intermediate layer and deep layer. Now the intermediate and deep layer, they join together and forms the vocal ligament. So between the superficial layer and these 2 layers, there will be a small space that is called as Reinke space. So at least the student should write. Number 1, mucosa, what is lined by? What is the lining epithelium? First point, how it is formed. So upper border of the cricovocal ligament. Number 1 mark will be given. Second point, stratified squamous non-keratinized epithelium. For that another 1 mark will be given. Number 3, it has lamina propria and there are 3 layers of lamina propria, and superficial layer and the next 2 layers joined together, and between these 2 there is Reinke space. At least you need not write all this stuff, at least write there is a space called Reinke space. And in 5th layer is your muscle, vocalis muscle. If you write all this stuff, you will get definitely 3 marks. And then next you have to write is between the 2 cords, vocal cords, there is a glottic area. There you have intermembranous part and intercartilageous part. Muscles acting on the vocal cord I have already told you. Just explain all these 4 muscles. So that's all enough for this video. We'll move on to the next video.